Hi everyone, I'm Danielle Griffin, and I work on the gene therapy research team at Sarepta Therapeutics. It's great to be here with you for the next installment of GTFAQ, designed to answer your questions on gene therapy science. Today's question: what are pre-existing antibodies and why do they matter to gene therapy? First, we'll start with what is an antibody. Antibodies form the defense system in the human body. An antibody is a protein that can recognize invaders to the body and mount a response to help fight off an infection. As your body recognizes these invaders and tries to recover, it generates antibodies to help fight off the infection. What's interesting about antibodies is that even after you recover, those antibodies remain. So that if you're exposed again, the antibodies would recognize the invaders and try to fight them before you got sick. Interestingly, some people can develop antibodies even if the exposure to the infection didn't make them sick. Have you ever met someone who never had the chicken pox, but when tested, it shows the person had been exposed? Most likely, that's an antibody response. So how does this relate to gene therapy? The delivery vehicles for gene used today, for the vectors, are viruses that are not known to cause disease in humans. Because these viral vectors are found in nature, it's possible that a person has been exposed to that material and has formed antibodies. If that and antibodies are present prior to delivering gene therapy, these pre-existing antibodies could recognize the vector and mount a defense against it, preventing the drug from doing its job. Before an individual with the gene therapy, patients will get tested to determine whether they have pre-existing antibodies to the vector. This test will vary based on the vector being used and the gene therapy selected for the treatment. If an individual tests positive pre-existing antibodies prior to gene therapy, it could make the individual ineligible to receive a gene therapy. If you have questions about any of the ongoing research or anything related to antibodies and gene therapy, we encourage you to speak with your healthcare professional. Thanks for watching. And if you have questions about science or gene therapy, drop your questions in the comments below, and we may answer you in a future video.